Hi, I'm Dr. David Greene with PreferredPainCenter.com, where we bring you anything and everything education for pain management. Today the topic is, what exactly is a bulging disc, and do I need to do anything about it if I have one? Maybe. The bulging disc is a little bit of a misnomer. Each level of your spinal column has an intervertebral disc, and it acts as a shock absorber. It's very flexible. As we walk, it loses water, gains water back, loses water, gains water back. In fact, it's 80% water. The other 20% is made up of collagen and some proteins, and it's very good at absorbing shock. So as you jump, it squeezes down because there's pressure placed on it. Water gets pushed out, water comes back in, and it allows us to bend and twist and do all the things that allow such an incredible range of motion of your spine, because there's so many of them. Every level has one: cervical, thoracic, and lumbar. So when a disc starts to degenerate, essentially what is happening is that it's losing water. It's becoming a little bit of a prune, okay? So water starts to leave the disc forever. So instead of having 80% water, it may be down to 60%. And what can happen is a disc that used to be this high will start to decrease. But it's still seeing the same amount of pressure when you walk, jump, twist, bend. So what can happen is a disc can start to bulge out, very similar to a flat tire. When a tire starts to lose some air and get flat, it starts to bulge. And that's one of the ways you can see that a tire doesn't have enough air in it. It's bulging out, put the air back in, it gets its vertical height back, and you don't see the bulges. So, is a bulging disc painful? The answer is no, it's not. Studies were done back in the 1990s looking at what percentage of people have a bulging disc and no back pain at all. And they looked at people over the age of 40 at MRIs of the discs to see how many of these are bulging. The answer is over 40% of people over the age of 40 have bulging discs and don't even know it because they have no back pain whatsoever. Okay? So just because you have it on an MRI doesn't mean it's going to cause you symptoms. Now, what's the chance of it causing symptoms? We know that over 90% of people in the United States have back pain at some point in life, okay? And over 90% of those, it goes away within 3 months, no matter whether you receive treatment or not. If back pain becomes chronic, if you're in that 5 to 10% where it does, that's a problem, because it can bother you every day, every other day. It can wax and wane. And how often is that due to a bulging disc or degenerative disc disease? Pretty commonly. I would venture to say of those with chronic back pain, probably 20% have pain due to a degenerative disc disease problem. And a lot of those are in a bulging disc situation. Remember, normal disc, degenerative, loses height, bulges out. And you can have bulging at multiple levels. It doesn't mean that if you have pain that it's coming from all levels. It might just be one of those that's causing the problem. Because if this, now we're looking down on a disc, okay? If this is the disc, round, the nerve endings are on the outside of the disc. If there is a tear in the outer part of the disc, it can become painful. It can spark up pain in those little nerve endings. The inside of the disc doesn't have any nerve endings. There's no pain coming from that at all. Okay? So if you're one of the unfortunate few who has a bulging disc that happens to be causing pain, what do you do about it? Well, at one end of the spectrum, you could get a fusion and take that disc out altogether. You could get an artificial disc replacement and take the disc out and put in, you know, a mobile bearing, a movement surface. But usually it doesn't come to that, okay? There's a broad range of treatments that you can undergo that can help prevent the need for surgery. but also not keep the status quo, which would be way over here, which is chronic pain. There's over-the-counter medications like anti-inflammatories and Tylenol. Then there's also chiropractic treatment or physical therapy, physical rehab. Then you could move into stronger medications such as muscle relaxers or narcotics, which are best done in a short-term usage. You could also have pain management injections, which may entail intradiscal injections or epidural steroid injections, or possibly, if you're also having some arthritis, maybe some joint injections or radio frequency ablation. Acupuncture can also help. A TENS unit can be very helpful. Spinal decompression therapy is something that can also help. So you have all of this broad range of treatments possible to hopefully elude the status quo and prevent the need for surgery. But just to reiterate, all bulging discs are not painful. Just because you have one doesn't mean it's going to cause you a world of hurt. But if you do, treatments are available. If you have chronic back pain, you think it may be coming from a disc problem, there are ways that pain doctors can figure that out. Arizona Pain Specialists has double board certified, award-winning pain doctors and chiropractors. They've won the Patient's Choice Award 4 years in a row. That's incredible. Multiple locations around the valley, take a ton of insurances, including personal injury, workers' comp, Medicare, Medicaid, pretty much all of the major ones. And they provide top-notch service, individualized care, and get you in quickly. So call today at 602-507-6550 for one-number scheduling. I'm Dr. David Greene, preferredpaincenter.com. Your pain stops here.